You may have just injured your shoulder or just had shoulder surgery, but nighttime pain is a common symptom with shoulder injuries. Hey you guys, it's Andy Good. I just wanted to talk to you a little bit about something I have some experience with, and it's shoulder pain at night. Mine after shoulder surgery, and a lot of people commonly come into the clinic complaining about shoulder pain at night, even if it's just a mild impingement and they're just starting to show symptoms. Nighttime seems to be the worst time. Some of the research really indicates two things: pressure and positioning are two of the key factors that play a role in pain at night in the shoulder. So one of the things that wakes people up quite frequently in the middle of the night is pressure buildup into the shoulder that starts to create a response to the brain, an ischemic response, a lack of blood flow, saying, ouch, 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 I need blood flow within that area. You have that same response anywhere in your body. If you sat on your bottom too long, your bottom would say the same thing to get up and move. So the shoulder does the same thing in the middle of the night when it's having an ischemic response. So say you're laying on your side for too long and that thing gets squished out of all the blood, it's going to say get up and get moving. So one thing I teach a lot of my patients is, say they're in bed, having them just sit up gently and rock the baby. So I'll teach them basically a Codman's in a braced position. This is a really good one post-surgically. They can work on gently rocking the baby. That helps move and glide that tendon and pump some of that inflammation out. They can do little circles, slow, easy motions, 10, 15. It doesn't take a lot. Slow and go in each direction. And sometimes that's enough to calm that shoulder down and let them get back to bed. When sleeping on your side, if the involved shoulder is the shoulder that you're sleeping on, you tend to protract your shoulder, which means your shoulder blade will move in a forward and outward motion, compressing the subacromial space. Similarly, if you sleep in a prone position or on your belly, you'll elevate your humerus or long bone, compressing the supraspinatus tendon up against the AC joint or acromial space. Studies have shown that the protracted position or shoulder forward reduces the amount of space for the tendon. The opposite, when sleeping on your back, the shoulder blade is found to retract or move towards the spine and increase the amount of subacromial space for the tendon beneath the bone. When coupled with a neutral position shoulder, this allows the most amount of blood flow and healing time during your sleep at the subacromial space and rotator cuff. Portions of the supraspinatus and infraspinatus tendons of the rotator cuff have been shown not to get good blood supply. Similarly, injured rotator cuff tendons don't get as good a blood supply as normal tendons. This makes it all the more important to position yourself properly to increase the amount of blood flow that you can get to healing tendons. When talking about the avascular zones, or zones where blood flow doesn't occur very well, the research really finds that the supraspinatus tendon attachment, as drawn here, and the superior portions of the infraspinatus are the areas of least blood flow and reduced healing. So as we've discussed, sideline position and a prone position on your belly tend to be not the best thing for your shoulder, and the sleeping on your back tends to be the best position for your shoulder. What I have taught a lot of patients, especially after a surgery, is to pad yourself up with pillows. I prefer two methods. Although we have found that retracting the shoulder opens up the joint space, that's really hard to do after a shoulder surgery. That's why we sleep in a chair for 4 or 5 weeks. And so getting into just being able to lay on your back is a challenge in and of itself, and you just take it one step at a time. I know with me, some days I would be able to sleep in bed, sometimes I would have to go back to the recliner for a little bit. Just listen to your shoulder and see how that does. But what I would do is take 2 pillows, and so what you would want to do, I'm going to use these pillows for now. You're going to, in a back position or a supine position, pad one under the elbow, and I would pad one behind the shoulder to keep it from drooping too far back. And then as I progress, I could slowly remove one, which would allow it to retract, especially after surgery. And then eventually I could move into a neutral position here. And in that time, my shoulder is healing over several weeks and eventually slowly working back to my normal comfortable sleeping positions. Yeah, one of the big challenges is a lot of people don't just have shoulder issues, they have low back issues as well and have a really hard time sleeping on their back. So it's something to discuss with your therapist. Lots of different tactics to kind of adjust around that. A lot of the patients that I see, I find that bending the knees helps quite a bit so they can tolerate it. The biggest thing is allowing yourself to get the most sleep that you can, because you're going to heal the best when you sleep the best. And so whatever you can do, even if it's for chunks where you have to wake up and move and rearrange over time as you heal and heal, that's going to get better and better. So when you are in that supine position, having the knees bent up, so having some pillows tucked underneath to help support that will unload the back and allow you to rest in that position. Hey, thanks you guys. I hope that helps with your nighttime pain with your shoulder. Just take it one day at a time. These things get better and better all the time, and I know a lot of them have helped my patients. And really talk about it day in and day out with your therapist, because they can give you a lot of different tactics to help with that. Thanks.